status, your responsibilities, personal and professional. So we need to balance it, understand it, and then continue our running, because we have to run for 10 to 20 years. We are not training for Olympics. I'm talking about we recreational runners. So if you have to run long, you have to listen to your body. Aditya, let's take them through the common running injuries which we face and how to avoid them and handle them.
Okay. So before we go about running injuries, just a show of hands. How many of you who are all of you runners, by the way? All runners? Thank God. All right. Okay. Congratulations. Now, how many of you आप में से कितनों के नी में पेन हुआ है पहले कभी रनिंग में या अभी होता है? Just a show of hands. So let's say about 6, 9, 10, 12 people. How many of you have a pain in the lower leg? Lower leg basically between your knee and your ankle. 1, 2, 3, 4, 5, 6. Alright, 7. Fair enough. How many of you have pain around the hip joint? Hip or your lower back? So again 4. So I'll tell you why I asked you that question. This is exactly the proportion of running injuries. The most commonly injured joint is the knee joint. So out of about 20 or 15 or, yeah, so about you included. So about 20, 25 odd people here, almost 13 have knee problems, right? 14, or it keeps on increasing. Yes. I can't hear you, I'm sorry. Can anybody give a mic to her, please?
I'm saying when I start running, it starts paining in my left knee, not in the right knee, but it subsides eventually.
Right, perfect. Yeah, so it basically subsides. Now, and after your knee joint, the most commonly injured other joint is, or rather the body part is your ankle as well as the lower leg, which you've gone through, followed by the hip joint and the back joint. Now there also, whenever a runner comes to us with an injury, we can tell them that, or rather we can diagnose it whether they are seasoned runners or they are novice runners. Somebody who's recently started to run will come to us with knee problems. But as your running career progresses, as you become a seasoned runner, the knee injuries actually start reducing because you adapt to your running gait. But you then start having the leg problems because they are stress injuries. So stress injuries of your lower leg are more related to the training volume, and a training volume for a seasoned runner is obviously much higher than a novice athlete. Now coming to that, why do we have more knee problems? That is the commonest thing we have to understand. So whenever you're running, you're using multiple muscle groups. You're using your lower back, you're using your hip muscles, you're using your knee and your ankle and your leg, the entire kinetic chain as we call it. But the only joint which acts as a link between your upper body and your lower body is actually not the hip and the spine. For running, it is your knee joint. Because the main propulsion when you do, and the main weight bearing joint when you impact the ground in your stance phase is again the ankle as well as the knee. Ankle being a joint which is more stable because of number of ligaments. It does take a brunt, but the maximum force transfer when you hit the ground, it is transferred to the ligaments of the ankle as well as the posterior muscle group, जिसको हम calf muscle या पिंडलियाँ बोलते हैं. But for the knee, there is nothing of that sort. Also, knee has a small bone in front which is called as the kneecap or the patella, and the patella is articulating with the thigh bone or the femur. That articulation is a very flimsy one. So there is a groove, and the patella has to go in that groove. For most of us, if you hold your patella and you extend the knee and you flex it, you'll realize that it is not in the center, it's actually tilted a bit laterally. Now for runners who have poor thigh muscle strength and hip muscle strength, this particular tilt keeps on increasing. And for female runners in particular, you have a higher angle when you come down from the thigh to your knee. So this is called as the knee valgus angle. And for people who are short-heighted and females in particular, because this angle is more, and when you run and when you fatigue, you tend to force your hip on the inside. This is called as hip adduction, and your leg tends to rotate outside. See what is happening to the angle. So you already begin with an angle which is higher, and you end up increasing the angle when you fatigue, and that causes the patella to maltract, and therefore the anterior knee pain. Yeah, जो many female runners who come to us, they complain of कि सर हम जब घुटना सीधा करते मोड़ते तो कड़कड़ की आवाज आती है. That classically happens because there is an inflammation of the patellar cartilage. So what do you have to do for it? One, always understand that your training volume has to increase gradually. Now for a very long period of time, the training volume, the figure which was quoted was that week after week your training volume should not go more than 10%. But the studies tell us that up to 30% increase in your training volume week after week is okay. So it's not 10%, it's actually 30%, but beyond 30% increase is going to injure you because your muscles simply can't take that load. Second, most knee pains have nothing to do with an overpronated foot, which unfortunately the shoe companies are trying to sell it to you, right? So overpronation is the commonest thing which I hear, and wearing orthoses inside the footwear because you have a knee pain or a hip problem is the commonest thing which is given to you as an intervention at a particular shoe shop, as I should call it. It never works. The studies are actually telling us that orthosis or wearing any kind of a support for your heel or for your sole is going to make you more prone to injuries. So rather than going on for external things, improve your muscle strength, keep your training volume within the limits of what you can manage, listen to your body, that's about it.
So could you just tell us about the pronation, what kind of?
Yes. So आपने चप्पल पहने ऊपर आए. So what Rajesh has asked me to demonstrate is foot pronation. So that is one thing which you will almost hear from anybody. अगर आपका repeated knee pain है, then the first thing people will try to tell you is you have a foot overpronated foot and therefore you have knee pain. Just ignore it. That's usually not correct. But what is an overpronated foot?
And they'll sell the shoes also accordingly as per your pronation.
So your foot, the most important thing in your foot when you're talking about running is propulsion. So you land, you may be a 4-foot runner when you're landing on the 4-foot, or you may be a heel striker when you're landing on the heel. So these are the two common forms of landing patterns. But no matter however you land, you will eventually have a heel off, right? So this is the propulsion phase of running and this is the stance phase of running, right? So when you're propelling your foot forwards, high school physics, kinetic energy converts into potential energy and then goes back to converting and gets converted to kinetic energy once again, right? So where is that potential energy stored? It's stored in the arch of your foot. That acts as a spring, and it is stored in the muscles at the back, which is the right in your calf muscles, right? So your calf muscles, your tendon or Achilles, and your plantar fascia. Those are the three things where you're storing that potential energy before you pull off. What happens in a hyperpronated foot is, so right. So I don't think you can see from there. Get up, stand up. All of you can't see, just stand up because you won't be able to see this otherwise. So this is called between the ball of the foot, जिसको हम लोग ये जो अपना अंगूठा है, between the ball of the foot and the heel of the foot is the plantar fascia arch. This is your plantar arch. Now for some people, you'll see that the arch has gone flat. When they are standing, the arch is flattened out. And एक बार पीछे घूमिए महेश. And if you look at the angle of the heel with the calf, in Mahesh's case, you will see that it's a straight line between the calf and the heel. In some people who have flat feet, the heel tends to go out. It tends to tilt laterally. So a combination of a flat arch and an outgoing heel or a outwardly tilting heel puts the foot in that position. And that is called as hyperpronation, right? Now it was said, thank you Mahesh, thank you. Now it was said that if you have a hyperpronated foot, you are going to compensate that, or you're rather going to compensate that hyperpronation by tilting the foot outside and externally rotating the leg and adducting the thigh. But that is not correct. In fact, 60% of flat foot, or rather the best planist as we call it, 60% people who have flat foot have no idea that they have a flat foot until and unless somebody comes and tells it to you. And more than 90% flexible flat feet patients never require any kind of a heel control shoe or an orthotic inside their shoes. So that is oversold to you. It doesn't make sense. Even if you have a flat foot, जब आपका flat foot आप अपने पैर को ऊपर ऐसे रखते हैं, when you're not bearing weight on the foot, if you see that arch, that means you have a flexible flat foot. You don't have to treat that, you're normal, right? And that is most likely not the reason for your pain. So this is what I meant by hyperpronation, right?
So from knee we come to the shin splints.
Right. So shin splints. Now, if you look at any stress injury to the bone, right? So अभी जो हम discuss कर रहे थे knee problem, there are soft tissue injuries. If you're talking about bone injuries, then it happens in 3 stages. Stage 1 is a stress reaction, right? Where there's a sudden stress on the bone and your bone is trying to react or trying to recuperate from that strain. Then you come into stress injuries, which is grade 2, and then the stress fractures, which are actual fractures of the bone, which is stage 3. One of our runners from Jaipur, and in fact in Delhi marathon last day, Pooja, she had a hip fracture while running. She started having pain around the 7th or the 8th kilometer, but she kept on running and she eventually ended up with a fracture which required surgery. So these are the stages. Now why do stress injuries happen? तो उसके लिए पहले आपको ये समझना है कि stress reaction आपका body का होता कैसे. So it's not only for your bone, for every organ of your body there is a constant cycle which is going on, right? So suppose you've run, जैसे आप आज सुबह, I think you ran 12 kilometers today. What a fantastic speed. I was looking at WhatsApp. So he ran 12 kilometers in the morning. Now when he ran, there are certain cells of his muscle and the bone which were